De Toca, and I lead the Australian Government's primary care response to COVID-19 here in the Department of Health in Canberra. Welcome to Top 3. We are streaming from Ngunnawal country, Ngunnawal Daura, so I'd like to acknowledge the traditional owners of this land and pay my respects to the Ngunnawal elders, both past and present, and extend that acknowledgement to the elders of the lands where people may be watching from around the country. My shout out today goes to returned Australians who are currently in quarantine hotels and other dedicated quarantine facilities like Howard Springs in Darwin. We can only imagine how much you're looking forward to going back to your family after living overseas, and we're really thankful that you're observing quarantine requirements and doing your part to keep us all safe.
First question. Could antibiotic resistance impact recovery from viruses such as COVID-19?
So, this is a bit of a left field question, because but it has been coming up. Antimicrobials or antibiotics are used to treat bacterial infections, and COVID-19, as you know, is a virus. But how is this relevant? It is potentially relevant because of the risk of secondary infection. Secondary infection is when a different organism colonizes and causes an infection in a tissue or an organ where a prior infection was occurring. The bacteria can take advantage of the weakened immune system or inflammation in the area to actually colonize the tissue and cause another infection. That was really common during the 1918 influenza pandemic, that incorrectly called Spanish flu, and it was responsible for a significant proportion of the deaths linked to that horrible pandemic, due to secondary pneumonia that people were getting when their lungs were being invaded by bacteria after they had been infected with the virus. We have instances of antimicrobial resistance all around the world, which means that bacteria are less likely to be successfully treated with antibiotics, and thus increases the risk of secondary infection with an antimicrobial resistant organism. As always, and for any COVID-related preventive measure, the best way to avoid secondary bacterial infection on COVID after a COVID-19 infection is to avoid getting COVID in the first place. And the best way that we can do that is to continue to practice the COVID-safe behaviors that we keep repeating in these videos and other messages. To keep practicing good hand hygiene and other hygiene measures, keeping physically distance to others, particularly in crowds or large gatherings, wearing masks if recommended by your local jurisdictional authorities, or if you cannot maintain physical distance in a situation in public, and staying at home and getting tested if you have cold and flu symptoms, no matter how mild they are.
Second question. Will the COVID-19 vaccine be available to everyone?
Yes, so when a safe and effective vaccine becomes available and approved in Australia, the state and territory and Australian governments are committed to making sure everyone living in Australia has access to those vaccines for free as early as possible. When we talk about everyone living in Australia, it's important to highlight that we are not just limiting it to Australian citizens or permanent residents. We're also including people on temporary visas, temporary work visas, international students, asylum seekers. So essentially anyone living in the country will have access to the vaccine for free. That also includes people who do not have a Medicare card. We will not be limiting vaccine accessibility to people who are Medicare eligible. Even if you're Medicare ineligible, you will be able to access safe and effective vaccines for free. Of course, it is important to note that initially, as doses become available, the vaccine will be prioritized to those groups that medical advice, public health expertise, and the Australian Technical Advisory Group on Immunisation have recommended and that are first priority to receive the doses. That includes people who are at the highest risk of severe disease and negative outcomes from a COVID infection. Also people who are at higher risk of exposure, like people in frontline healthcare work or people working in quarantine hotels and other international ports and facilities who are keeping us all safe by preserving the protection that the international border provides us, and also people in professions and occupations that are essential to and critical to the functioning of society.
And finally, will children of all ages also be able to safely receive the COVID-19 vaccine?
So, as we've been saying in these videos as well, it's important that we clarify that at the moment, there are no vaccines approved for use in Australia. The Therapeutic Goods Administration is following a rigorous process, as they do for any other therapeutic good or drug, to make sure that approvals follow a strict safety, quality, and effectiveness assessment. Once we're hoping COVID vaccines become approved by the TGA after they're comfortable that they're safe and effective to be used in Australia. And at the moment, the TGA is reviewing applications from the Pfizer-BioNTech mRNA vaccine as well as for the Oxford AstraZeneca vaccines. Then the TGA will give us an indication of what the final recommendations for clinical use, spacing between dosages, and target populations is. However, there is no currently available data on the use of COVID-19 vaccines in children. So it is unlikely that when the TGA approval comes, COVID-19 vaccines will be registered to use in children in the short term. There is more data emerging almost by day from use in other countries and from other clinical trials. So it is likely that this will be reviewed as the vaccines are being rolled out. And maybe in the future, we will be able to reassess those recommendations and make the vaccine available for people under 18 or 16 years of age. But at the moment, as vaccines hopefully become approved soon, as we expect, they will not be available for children in that first instance. That's all for today. Thank you for watching, and as always, thank you for staying COVID safe. Thank you.